Um, we're going to have a slight adjustment in our programming. As you all can see, there's a bit of a timing issue. So we're likely going to just round out the meeting with closing remarks from Dr. Wendy Ellis. Please continue to submit if you'd like the questions to our Q&A box, and we'll do our best to facilitate responses if we're able to. Dr. Ellis is an assistant professor in global health and the founding director of the Center for Community Resilience at the Milken Institute School of Public Health at George Washington University. The Center for Community Resilience seeks to improve the health of communities by enabling cross-sectoral partners to align policy, program, and practice to address adverse childhood experiences in the context of adverse community environments, or as Dr. Ellis has coined it, the pair of ACEs. This innovative framing of ACEs with an explicit focus on equity and prevention has had a substantial influence on local initiatives, programs, public health initiatives, and local, state, and federal policy. Using the pair of ACEs framing, building community resilience networks has successfully led systems and policy change focused on addressing long-standing economic, social, and health disparities by partnering with community, integrating service delivery, and building political will for change. Dr. Ellis, I'll turn to you for a thoughtful analysis of our conversation today and some remarks from your end.
Yes, thank you. It is an honor to follow these esteemed panelists who are doing exactly what we really push at the Center for Community Resilience, and that is we are not going to get to long-term and substantive systems change if we are not including the voices of the community, if we are not including the lived experience of those that have been held back specifically and intentionally by structural racism. We heard Dr. Warner talk about having 3 moon rocks, having 3 golf balls on the moon, and yet not a similar representation amongst the highest levels of academia and schools of medicine. We heard the struggles of the recent census and understanding that there were intentional systemic barriers, intentionality behind fear and the oppression of voices of color. This is nothing new for this country in 2020. We have a long history of the deliberate oppression, subjugation, and intentional near genocide of people of color in this country. And so it's no wonder that we have differential outcomes in health, social, and well-being because of the intentionality of those policies. So at the Center for Community Resilience, as you've heard throughout these conversations, is these drivers, whether they were in the racial wealth gap around economic mobility, or whether educational attainment, or the fear of law enforcement and criminal justice. These things work synergistically together. It's not enough to just think about the indices of these specific sectors, meaning the outcomes that are associated with them, but it's also important to understand the pathway. How do we get to these outcomes? And that's where the community voice comes into place. That's why it's important to really understand not just the policies and how they've been implemented, but what is the experience along the way to reaching those outcomes. So in our work, and I think in this work collectively, we have to begin to get to what was the title of this session. How will we define and how will we measure success with regard to equity? Is it the beginning, yes, to have the courage amongst ourselves and within our communities, and certainly within our organizations, the courage to coalesce and understand the intentionality behind structural racism, the drivers, and how they interact and create these vicious cycles of outcomes. But then through that dialogue, through that understanding, through having community voice at the table, build the political will, I would challenge you, the moral will for change. That's why we heard throughout all of these presentations, the stress on inclusivity. Who leads the research? Who has a place at the table? Who fundamentally is asking the research question? Is the question that we ask even relevant to the community? And will that get us to the solutions that we need from a community perspective? Or is it once again a research question that is most in favor of our systems? If we start with questions that only look at reform and payment and not necessarily looking at whether or not that reform and payment from a healthcare perspective truly then gets us to a systems change with regard to the delivery of services that are relevant to the community and the experience of that community, then we've wasted our time. When we talk about how do we get there, we have to establish these relationships. We have to establish and maintain trust, not just to our specific systems but really, truly, to those partners, to the community that we serve. This means holding space for very difficult conversations. This means fundamentally rethinking how we will measure success. It's not just by what we have been incentivized financially or otherwise to do, but what really serves the community, what really will break these vicious cycles of inequity that we've seen. I really appreciated when Petra Harmon One Hawk said, "We cannot be healthy and whole if our entire environment is not healthy and whole." When we think about the outcomes that we see in our communities and the differential outcomes based on race, based on income, based on education, we can see the differences in the environments. At the Center for Community Resilience, this is why we put so much emphasis on looking at those systems that most inform the community environment: housing, public education, law enforcement, and criminal justice. These systems, backed up by our social determinant literature, help us to understand how these systems and their outcomes inform that community environment. That community environment then informs the outcomes that we see at the individual level. So how will we have different outcomes if we don't have the difficult conversations to understand the impact, the inequitable impact that these systems have, deliberately, intentionally, and almost predictably, based on the differences in race and income of the communities? And again, this is why you've heard throughout this afternoon's conversations why the community voice is so important. That is the challenge for us today. It's not to just look at the delivery of healthcare and how do we make healthcare more equitable. It's looking at the access to the services that actually support better outcomes with regard to health, social, and economic well-being. It's looking at that through the lens of health that will improve our healthcare outcomes. So the challenge again is, how will we raise up our young leaders like Anaya? How will we have these substantive, informative conversations at the intersection of race, gender, education, and age? How will we take these young voices such as Anaya's, the leaders of now, and joining them with the leaders of today, such as Sherry Dorsey Walker, and the leaders of all of our communities, that if we just listen, there are more Anayas out there. But we have to listen, we have to hold the space, and we have to be willing to be uncomfortable. Just as uncomfortable as many of our communities of color have been for centuries and continue to exhibit resilience despite having systematic barriers intentionally put in place. That's the challenge. And I challenge you to go and look at your own measures of success and ask, do these really matter to our community? Do these really measure how our community needs, what our community needs to be successful, to thrive in an equitable manner? So that's our challenge as we move forward into this brave new world. And it's a brave new world because it will be an equitable one of which we've not had before. So we don't have a model to build it upon, but we have a vision that with the voice of community, we can create. So thank you.
Dr. Ellis, you can't hear all the applause that I'm sure are in the background of many of those who have joined us. So thank you for that thoughtful reflection on our presentations of our speakers, but also for highlighting the importance of moving beyond theorizing and acknowledging that community voice is so important and truly moving towards that action and that implementation. So again, thank you to you and thank you to all of our speakers. We are going to have a slight adjustment to the programming. As I said, we won't be conducting a Q&A, but thank you all for the questions that you've submitted. I know that a number of our speakers have been responding in the question and answer box, and we will continue to hold on to these questions. And as I said, just try to see if there's a way for us to get them answered. I want to thank again each of our speakers from this afternoon and this evening. Each of you has given us critical food for thought as we consider how we ensure that we are not only bringing the voice and the perspective and the lived experience perspective to the table, but truly acting on that and being conscious in those efforts. And again, speaking to that concept of equity. It's not enough to just hear and do to a community, it must be with. And we need to be considering what is the response that is meeting the needs of the communities that we're serving. And so I won't offer a second challenge. I think, Dr. Ellis, the challenge you put forward is something that I want all of us to leave today with holding in our minds. So with that, thank you all for joining us. We do have our third session will be tomorrow afternoon. And we'll be discussing the way forward for community-driven efforts to advance health equity. Again, that's tomorrow, Thursday, December 10th from 4 to 6 p.m. So I'd like to thank you again, speakers, for joining us, and to all of our participants on the line, thank you for your active engagement in the conversation via our chat and via the question and answer session. We look forward to having you all join us again tomorrow. And with that, I invite all of you to sign out. And again, thank you for the thoughtful work that you are each doing.